Welcome everyone. My name is Paul Erwin and I am the Dean of the School of Public Health here at UAB. I'm excited to welcome you today to this career conversation with alumni Stacie June Shelton. This webinar is made possible by the Office of Public Health Practice and the Public Health Student Association, the PHSA. Please take some time to visit the OPHP website to see past seminars, and always check the PHSA calendar for upcoming meetings and events. Stacie June Shelton is a 2001 MPH graduate of the UAB School of Public Health, graduating with a concentration in health behavior. Currently, she is the Global Head of Education and Advocacy for the Dove Self-Esteem Project. Her work is focused on a set of programs and interventions designed to develop and increase body confidence and self-esteem in young people around the world. She is driven by a desire to help empower the next generation of girls and women to reach their full potential in life. Ms. Shelton has more than 20 years of experience in public health research, program and partnership development, and project management. She has also worked in the private sector with government agencies and NGOs around the world to develop meaningful behavior change interventions and health education programs on issues ranging from HIV, mental health, physical activity promotion, and adolescent health. Before joining the Dove Self-Esteem Project in January 2016, Stacie was Global Social Mission Program Manager on the global brand team for Unilever's Lifebuoy soap, helping the brand promote water, sanitation, and hygiene behavior change among communities in Asian, African, and Latin American markets. She has worked in Mumbai, India, Nairobi, Kenya, and other places internationally. And I make note that her first job upon graduating with her MPH was with the Oregon State Department of Health Services. So with that, Stacie, welcome back to UAB.
Thank you. Great to be back. Thanks for inviting me to talk today.
Great to have you here. Great to have you here across the big water, across the pond, maybe. You heard my introduction. And indeed, you are joining us from England, and we'll make note of that, and we'll probably get some questions about that. But tell us a little bit about yourself and where you work and what you do to get us started.
Sure. Yeah, it's evening here, so I hope there's enough light on. I have all the lights on because it's about six o'clock here. But yeah, I work on the Dove Self-Esteem Project for, a big fast-moving consumer goods company. Unilever is the parent company. So we have lots of other brands like Ben & Jerry's, you may be familiar with, or Seventh Generation, or Lifebuoy, as you mentioned, Domestos too. So I've been working with the private sector now for 10 years. 5 years on Dove and 5 years formerly on Lifebuoy. I'm an American from Oklahoma, but I have been living outside the US for the last 16 years.
So we're going to explore your career and your career pathway, and hope to gain some insights along the way. As I mentioned, your first job was with the Oregon Health Department. Why did you pursue a job in government, in governmental public health, and how did that influence subsequent career choices?
So happy I had that experience, and I've been able to apply that government experience in the US now, even in my international health work, when we're working and partnering with different governments to have programs implemented. But yeah, I was wanting to work on adolescent health and school health, which is a real passion point for me, and population I wanted to work with, and wanted to kind of work at that policy level and see what we could implement at the state level. And I had done some training as well as a teacher in health education, as a health education teacher. So I wanted that experience of combining that work with the Department of Education and Department of Health in a coordinated school health project I was working on there.
This was one of the early CDC coordinated school health projects, as I recall.
Yeah, Healthy Kids Learn Better. HKLB was our acronym, but yeah.
Great, great. So after Oregon, you went to Mumbai, India. How did that happen?
Big leap, huh? You know, I was always interested in international health and even considered it when I was in the School of Public Health, but I just didn't have the experience and background. You know, a lot of students I think have done Peace Corps, have other international experience. So it had always been something in the back of my mind. I had kept in touch and, you know, had made close friends with some colleagues at the School of Public Health. So Sanjana Bhardwaj was an excellent friend and classmate. And once I was interested in looking at opportunities and experiences abroad, I got in touch with her, and she and her husband, she was working for, was working for UNICEF at the time, but she and her husband had a health foundation, and it really gave me some great hands-on experience in Mumbai. And I was totally torn, actually. Do I find opportunities in Africa, India? I just wanted some experience to at least know, can I do it? I hadn't really been outside of Mexico, Canada, and France, so I just didn't know. So that it was a passion, you know, something I'd always wanted, that adventure and wanting to work in those settings. So yeah, I got that experience, and then it built on from there. I loved it. After 3 months, I then found a position with Population Services International. And here I am, still working on international projects, living abroad.
And from Mumbai, did that serve as your base? So out of Mumbai or from Mumbai, you worked in Nairobi and other places in Africa and other places internationally? Yeah,
I mean, I worked on projects in India for about 5 years. So I had urban projects with PSI and HIV/AIDS prevention projects, as well as my work in kind of rural settings and going back to school and adolescent health, implementing WHO's health promoting school model in rural ashram shala schools there. So after that, then yes, I joined Unilever, and from that Lifebuoy position, the team was based in Mumbai, but I was still looking after projects, like I said, across Asia, Latin America, and Africa. And finally, as part of the Lifebuoy team, I went to Africa because I was looking after a couple partnerships there, one with Millennium Villages from the Jeffrey Sachs Millennium Village Project across 10 countries in Africa. And then another project on trachoma prevention with Sight Savers International. So I was based in Nigeria and Kenya to be closer to those projects, but yes, still working on the Lifebuoy global team.
So now you're in England, you're in London.
Yep.
And, so what does a typical day look like for you there? What do you do on a normal day?
A normal day. Well, I'll tell you about today. So I'm on a global team, and we're based in London, but then I have different teams that work on these projects in about 30 different countries. So I usually end up starting my day talking to some of the countries in Asia. So I was speaking to teams in Indonesia this morning. We were looking at animatics for new films and scripts we're making to develop like a guided social intervention. So I was talking to academics, psychologists, and the partner Girl Effect that are in the agency, the creative agency. So yeah, that started my day. That was a couple hours. And then I had, further meetings and calls. I spoke by the time the end of the day came, I was speaking to the US market Dove team, and we're creating some, again, about tools. We're working on some natural hair discrimination tools to build up body confidence and acceptance for young people who want to wear their hair naturally, and some appearance-based bias prejudice tools for school administrators and businesses to use as well. So yeah, I would say 25% of my day is usually spent like talking to partners, tool development. Another part of my day was spent with kind of reviewing contracts. So we have a new partnership phase with our Girl Guides and Girl Scouts partnership. So I had a call on that. I got to take a lunch break, try to fit in a walk when I can, because the weather in England isn't too great, even though I know you guys are having crazy cold weather right now. And yeah, another 25% of my day is usually spent just on admin stuff too. So finance and not super exciting processes, but we're a big company and we have big processes, steps and systems. What's nice is we have lots of different trainings offered, whether it's marketing training or business training. So I will often get some capacity development, not in a day, but within the week. But yeah, lots of phone calls with partners in different markets.
How has COVID impacted your work?
Obviously not face-to-face, but to be honest, even when I would be in the office in London, I was on calls with people in different countries anyway. So being on Zoom calls, video calls is not a big change. It's impacted the work in terms of, a lot of our programs are school-based. So access to schools is mixed, and we've had to look at, adapt to the hybrid models schools are having to take for learning now. Research has been impacted. So, we work with academics and run randomized control trials on our interventions just to prove they're having the impact we want them to have. And we've projects in India and Indonesia. I have to pay attention day to day, like which state is opening schools? Can we have access? Are we going to have to change our research model and methods to go to the student's home to ask questions? So yeah, the actual delivery of the programs we've had to pivot and be super agile, find digital means to do that. And then, yeah, all research has just been impacted in a huge way.
You've mentioned programs and projects that takes up a lot of your time, a lot of your work. I'd like to dig a little bit deeper, if I could, and have you talk about and maybe give a couple of examples about projects and programs, particularly evidence-based interventions that you've seen work with success for girls and women. Can you give us a couple of examples, please?
Sure. I think this is what really inspires me about my job is the ability to scale up interventions by working, with a company like Unilever and on a big brand like Dove, and the geographical footprint we have, but then the access to innovations and channels to kind of deliver the intervention. So yeah, all of our tools are evidence-based. Body image, falls into a mental health issue. So we're leaning on mental health interventions we can take at scale. So like I said, school-based interventions is a majority of our kind of on-ground, in-depth reach. We've been inspired by the social ecological model of health to inform kind of what our strategy will look like and how we want to make the biggest impact possible. So we definitely have those individual level kind of parent tools and workshop tools for the classroom setting, but then we've expanded to gaming. So we've created this really cool game and sometimes I think we can have great ideas on how to create digital interventions, but it's also about how to drive traffic to them and get engagement with your consumer, with your target audience. So, again, lending on commercial private sector practices, there's like in-game ads that will pop up into, like, as someone's playing Subway Surfer or Candy Crush, and then they can play our game that delivers them the body image messages, and then even has a cognitive dissonance element to it for them to, make a pledge, do something different to what they're currently doing. So I think that incredible kind of access to the creative agencies, but then that dissemination implementation models that, private sector is already using for advertising and marketing, but this is basically social marketing. And one we're really proud of is then we took it out a bit further in the model, and it's a bit more passive micro intervention, but we developed cartoons. So they're 60-second cartoons. We developed, again, with Cartoon Network and this amazing creative Rebecca Sugar, and use the body image messaging, tackling like our 6 core themes we have on body image. And we're able to deliver them on TV and reach huge audiences. We delivered that in 12 countries in 4 languages. But during 2018 and 2019, we reached like over 20 million young people, 7 to 14. And then we also did a randomized control trial with the cartoons to prove when seen twice, it does have a positive impact on body image, significant impact on body image and moods and overall kind of self-esteem and mental health. So yeah, it's really the mix of the science, I think applying my public health knowledge and expertise on how to disseminate tools together with the psychologists and academic experts on the content of body image, but then the creative agencies and all the mechanisms and channels to deploy it that the private sector has, and the agencies we can access to do that, like Mindshare. Yeah, it's really incredible. And I know the credibility of our programs and the evidence base is really important to us. We find that usually academics are thrilled to work with us because they can create it, they can test it, they know it's impactful, but their ability to disseminate it, they just don't have the footprint that we do. So yeah, that's just some of the things we're doing. We're working on some new ones now, a chatbot with UNICEF in Brazil, and they've already done some chatbot work for tackling sexting and cyberbullying. So now we're going to apply a similar model of like an older peer talking to the younger peers and talk about some of the body image issues, including racism and appearance-based prejudices, which is prevalent there.
You bring to mind a whole host of issues, not the least of which is the potential negative and positive impacts that social media has played. You're talking a lot about using different digital platforms, and I'm curious that especially during the time that you've been involved in this work, how have you seen the impacts of social media evolve and play out in the lives of girls regarding adolescent mental health in particular?
Yeah, now media, if you look at the tripartite model of health, which informs the kind of modifiable risk factors for body image, media, peers, and parents are the 3 modifiable risk factors. So yeah, media and media literacy is a real big chunk of kind of what our messaging is and what we're constantly having to update, because yes, the media world is constantly changing. But yeah, I mean, I think we know social media is not going away. So our overarching message is let's use it for good. Absolutely. We know, studies show 3 hours or more on social media, you start to see really negative impacts on mental health, including body image. from what I in talking to more researchers about it, is we want to develop interventions, and we even talk with Facebook and Instagram about possible policy and platform changes that will, and other intervention opportunities on their platform, is more about how that 3 hours is being used versus just the time itself. So although we may not reduce people's time on on these social platforms, we could help influence what they do. And so more passive scrolling, the social comparisons, just looking, that tends to have a more negative impact versus using the platforms for engaging with, your tribe, finding people that have things in common with you, engaging and chatting with friends and family. That more active role social media can play is what we want to encourage more of. What we teach a lot of, is the media literacy around understanding the digital distortion of images. And traditionally, this had been us, like Dove and other Unilever brands that would, distort their images, Photoshop them. But now on social media, anyone can do that. But raising awareness that, this is happening. Everyone's digitally distorting, everyone could be putting filters on. So in that kind of process of internalizing the ideals and then social comparisons to them that causes that psychological damage, don't compare yourself to these images that have been manipulated is another kind of core message we talk about. But yeah, I think we know it's not going to go away. So it's how can we work with them to make a healthier environment on social media. One ask we've had is, at sign-on, can we ensure all kids go through like a media literacy little course and get a badge? And so yeah, lots of ideas of what to do, but I don't think it's going away. We just need to find better ways to use it. Yeah.
Well, let's take a pause and check in with Dr. Lisa McCormick, who's our Associate Dean in the Office of Public Health Practice to see if we have some questions on the board there. Lisa?
Yeah, Stacie, one of our viewers are wanting to know, how do y'all take into account cultural differences in implementing your initiatives in different countries?
Yes, that is a big challenge. Always contextualizing the content. In examples like in UNICEF, we have in Indonesia and India, we're integrating body image modules into curriculum, the kind of government curriculums, 8 states in India, and then the national government in Indonesia as part of life skills education. So we're from scratch developing the content with experts in those countries. The school program's a different example where it doesn't have as big of reach within a country sometimes. So the kind of minimal adaptations we'll make to ensure that kind of cultural context is there. Imagery, so if we have images of kids, in the UK, having images of local children in Malaysia or in Thailand or in Brazil, that's one way. The kind of mechanisms of the influence on body image are quite the same. The tripartite model of health, of influence on body image, and then I mentioned the media, peers, and parents. So although it's going to be the media is presenting the appearance ideals and the social comparisons are happening, that's a human truth, we could give examples of local media in that country, local Bollywood stars, for example, as that example of the media. So that helps contextualize it. Language will help us contextualize it as well. But yeah, ideally, if we know we're going to have some really big reach, we'll create it in that market and co-create it with youth, like we've done with the chatbot in Brazil, what informed kind of the content and scripts, what we're going through like workshops across 11 provinces in Brazil, getting that feedback from the young people, and then that fed into kind of what the script would be. We still tackled, you know, media literacy, social comparisons, appearance ideals, but how we talk about that in that country can change, and through the examples we're giving.
Let's take you back to your time here at UAB, Stacie, and let's talk about your experiences and the opportunities that you had. What were those experiences, opportunities that you participated in while at UAB that that has influenced and has impacted your ability to be successful?
I mean, definitely there were courses I can recall that, you know, I'm pulling back that knowledge on now, the, you know, theory, behavior change theory, research method and designs. Even though I don't run research projects, I need to be aware of how they are run by the academic teams we work with. So those were really important. The international health course I took, even though I wasn't in international health, I did take a course, and that really opened my eyes to some of the approaches to international health. And I had taken, might have been one of the first, it was so long ago, but digital health interventions course. And I remember, I mean, at that time it was just so bizarre and so complex, but now I know how to make a wireframe, or at least I know what the wireframe is when a digital agency presents that to me. So yeah, some really great coursework. I think the access to work experience, you know, I was a research assistant on a cardiovascular health project down in southern Alabama, and even an organ donation project I worked on too. But that kind of community engagement, community health advisors, but really hands-on experience that I had access to, even if it wasn't necessarily topics. I mean, organ donation was not something I thought I would ever work in, or have I before, but those skills were transferable. And that experience, you know, I've used that, I've built on that and used that throughout. The networking. So like I said, you know, Sanjana Bhardwaj, I still keep up with her when we're both busy people, but when we do get a chance to chat. So yeah, networking, just for those contacts you want to have, you know, at future work prospects. Or I know I just had some good friends who we played intramural soccer with or something. So I think that networking was really incredible. What I think I found I've used across every level, every single job I've had, whether it's government or nonprofit or private sector, are those opportunities. I don't remember which course it was, but I remember doing case studies with, you know, people across all functions of public health. So we, you know, when we brought together, when we worked on a team, we had case studies. And I think that multidisciplinary approach is something I've had to use everywhere. You know, there's not a moment I work in silo very often, maybe when I'm reviewing a contract, but then I've now got to go out and talk to finance, and then I've got to talk to legal, and I've got to work with the communications team. So I think learning how to work in multidisciplinary groups is really, yeah, really important experience I had. My evaluation course was good too. I think, again, probably because it was hands-on and I got to like go see a program, evaluate it. And that also fits into kind of my style of learning. I like hands-on experiential learning.
Yeah, well, it sounds like there are a number of courses that you took that directly relate to the work that you're doing now.
Absolutely, yeah.
Let me ask you this question then. Like this is it's not a curveball, but it wasn't
Okay.
it wasn't on our list. what's a course that you didn't take that you wish you had taken that you would suggest for people who want to maybe follow a similar path, you know, really take this course if you have an opportunity?
More on policy, I think healthcare policy. I don't recall. I must have, yeah, I'm sure I had it, generally, but I could have used more on policy, but that's for my role and what I'm doing now. We're getting more into advocacy and social policy change and, wanting to do more than just the individual level interventions. I feel like that's an area I'm having to learn on the job or self-teach.
What advice do you have for students as they transition to life after school, whether they're undergraduate or graduate students?
Yeah, I mean, I think be open-minded. I certainly didn't have the traditional public health path. I mean, I would have thought I'd get that job in government and I stick with that, for 20 years later, I'm still working in government and working my way up, which some people might do that and that's perfect for them. But I'm glad I was open-minded about different opportunities and I still had the opportunity to explore international health, even though I didn't focus only on international health in the program. I made those opportunities available. So be open-minded and, network with people, think outside the box, be creative about what you can do in terms of think outside the box. Don't just be traditional in your way of thinking about public health in general. I mean, there's, like I said, there's so much I've learned from now working with creative agencies, communication agencies, digital agencies, and different partners. I feel like I'm learning all the time. Be courageous.
Let's check in with Lisa and see if we have some more questions from our participants. Lisa?
Yes, Stacie. So one viewer is wanting to know what types of social media do you focus on, and is that different from country to country or population to population that you're targeting?
So in terms of platforms, we've worked mainly so far with like Facebook and Instagram. We're actually looking for what is that next, because we know like Facebook isn't so big in US and Canada and some of our bigger Dove markets. We're looking for what is the next social media platform. So we've done some stuff on TikTok. So maybe looking at TikTok perhaps for an intervention model too. I think what happens a lot in like Snapchat too is they could be popular, but sometimes there's such negative influences on body image on those platforms. For example, like Snapchat, that's constantly, even if you put fun dog ears on your face, they actually convert your face to look as the appearance ideal. So they'll widen your eyes, they'll narrow your nose. So they're automatically filtering and photoshopping your body to meet an appearance ideal. And I've resisted like working with Snapchat due to that. We're looking, for in that market, what is the big, what is the main platform. So Brazil, the chatbots on Facebook Messenger. In Indonesia, it's a guided social journey that it's through kind of Facebook communities that the NGO partner Girl Effect already have. We'd always be looking at what is the next big one or what do we do. We're looking at gaming now. I think through gaming and inputting messages into gaming or scenarios into this kind of choose your own journey story gaming like Roblox. That seems to be a popular one with our age group too. So we're constantly looking for what's the right platform to reach the young people with our messages.
And then another viewer wanted to know, what are the pros and cons of working for the private sector versus the public sector?
I have to say, I was super skeptical. I was working, in public health with like the NGO sector, PSI, local Indian NGOs. before I was invited to join. What I was impressed with is, in my boss at the time, she was a friend in the social circle of other public health people who was working on Lifebuoy. What I was impressed with is she was using the behavior change theory, that we use in public health. She had the science, she had the theory, but then the way they packaged it up and implemented it with the creative agencies was just so impressive. PSI does, they focus on social marketing and actually employ a lot of people from the private sector in creative agencies for that purpose. But I could see where coming together with the science and the creative element would be so powerful. So yeah, I joined and I thought, I'll give it a try for a year. Let's see. And now 10 years later, I'm still doing it. And yeah, I think one of the challenges I find day to day is in my current role is I don't have public health people on my direct team on Dove. I did before on Lifebuoy. I had a bit more people from kind of the WASH sector on my team from public health. But I do, I work with all sorts of partners, UNICEF, I work with academics. So I am working with them in an extended role, but not on my direct team. Like when you're coming up with strategy and things like that, it feels like it's on me. So yeah, that is a challenge sometimes. I think it's pretty fast paced, which I love and hate. I've gotten kind of addicted to the pace of it, and we're fast moving consumer goods, especially now on Dove, where we're responding to media in media, because media is such a big influence on body image. So, it feels like your projects I have to get ready in 6 months, less than a year, they expect, new interventions out, tested, implemented. So the speed of things can be a bit exhausting, and I have to just learn how to make sure I have balance in my life and don't get caught up in that kind of the speed and fast pace of the private sector. I think it's really, I like being on the cutting edge because I think Unilever is a bit ahead of the game, maybe because they're a European company, in thinking on brands with purpose and making sure, they're integrate, like we've been looking at our social impact now. They had the Unilever Sustainable Living Plan from 2010. And our CEO at the time was like a leader in terms of, he was recommending, to Ban Ki-moon on all the new, as they were moving from MDGs to SDGs. So I think Unilever is ahead of the game and having brands with purpose and making sure, the impact on the environment and supply chain and human rights, like, we look at it across the board. What is our social impact? So that's incredibly rewarding to feel like I'm, with a company that's so forward thinking. And now, even if I go to sustainability conferences, everyone's always talking about Unilever. So now the big companies and brands are coming on board and realizing consumers want to know where their products are made, how they're made, what they're made with, and that their purchase is hopefully making a positive social impact if they can. So we're kind of a shining light for other private sector, and I hope we can move the needle to make sure everyone, all brands and businesses are ensuring they're having a positive social impact. Imperfect, I can't say, everything Unilever does is perfect, or every brand, but it's really rewarding and exciting to kind of be in this progressive space, I think.
I have a few more questions for you myself, so
Okay.
I'm gonna proceed on.
Yeah.
Clearly, your work primarily has been internationally. What skills would you recommend that students have if they also want to work internationally? And talk about how students can break into working in the international setting. You alluded to this in your comments about having a contact, a friend, or a colleague who you connected to help identify a first opportunity for you. So talk about that. Talk about please, the skills that you would recommend
Yeah.
students have, and then how they break in.
Yeah, personality skills, personal skills is patience and persistence, I think, and a lot of things, how I wanted or expected something to happen, how I thought it should happen when I'm implementing a program, say in India. Yeah, there's so many barriers that pop up you never dreamed of. I just needed to have the patience, but yeah, really have the persistence to not just give up when you face the first barrier. Yeah, I mean, just hands-on experience. I mean, I get it. I get why, one of the requirements to go into international health is probably, to have that Peace Corps experience or some other experience, because you just don't know until you've done it, living there and how you're going to function as a person day to day, but also how you're going to get the work done, because there's so much that comes up that's contextual that they can't put into a book. So it's not in our books. I may want kids to wash their hands, but if there's no electricity because of power cuts, and then the water pump doesn't fill, doesn't fill the water holding tanks. There's so many barriers that you just don't even think of that could possibly come up until I think you have that experience. So yeah, get the experience. I mean, like I said, I didn't go the route of, hadn't done the Peace Corps before, hadn't had the experience beforehand. So I just went and volunteered. I offered my time and my public health skills and said, I'll do whatever you want. I just want experience.
Mm-hmm.
Got from that experience, I could then get paid roles. I think, don't go at it for glory either in the beginning. Be ready to take any kind of menial role you can, just to get, like I said, be in that environment, work in that environment, talk to people. So yeah, it's experience. There's a reason they have those requirements to have that hands-on experience.
It's very similar to many of the things that we tell our students in terms of internships, of using those internships as opportunities to get your foot in the door.
Absolutely.
You've worked a lot with females in different settings. And clearly, as you have mentioned, and as some of the questions have alluded to, there are occasionally cultural and social barriers. Talk about some of those barriers that you've faced in different societies in program planning or implementation, and how you manage those.
Right now, my work on Dove and the Dove Self-Esteem Project, we do talk a lot about girls and women, and just because the appearance pressures and body image, the data shows, there's higher rates of prevalence among girls and women that they're facing disproportionately to males. The body image pressures could be lack of data too, because there's more and more coming out in the pressures for males. But yeah, I mean, internationally, I think it seems to come down to a lot of the gender norms and stereotypes that, maybe are starting to be broken down in society, in say the UK or US, but because those still exist in some of the international settings I have, it's this added barrier of just their time. They're expected to have certain roles, and they're doing all the unpaid care and unpaid work in the household, and you just don't have access to them. You don't have them for the kind of health intervention. They're not given sometimes the decision-making power in the household either. So you would need to go through, males. Our programs are actually delivered in co-ed settings, and I think this applies to other. I know it did with HIV/AIDS in India as well, that you actually, even though we want to impact the woman, we need to have the males along as allies or support. So in HIV, if we can't just teach the women that they need to wear a condom, you need to actually make sure that the men, would know that they need to use condoms. We can't expect the woman to just enforce it, I should say. But the same thing, for appearance pressures and body image is a lot of the pressures are coming from peers. So it's important for us to bring the males along in the journey too. So yeah, we have a real comprehensive approach, but yeah, I think those kind of gendered stereotypes and roles that need to be broken down in a really sensitive way, culturally sensitive way. We can't just come in, as a brand or society and say this is the wrong way to do it. But through that engagement with community, talking to them, I think that's where we discover, this is really the problem we're having. This is, the women will tell you this is the real problems they're having. So yeah, I think there's still a lot to overcome to kind of get to that gender equity we would want to see in the world.
Clearly, those are huge challenges in your engagement with different cultures, different societies, different populations. What about other challenges in your work?
Again, I think just as it is whether I was in government and needing to get funds, or in the NGO sector and applying for grants, and even now trying to get budgets allocated to my projects, it's prioritizing and getting the budgets you want to do the work you want to do. That's a constant challenge. I may have great ideas, but I need some money to execute those. So yeah, getting the right resources in place. Like I said, the challenge of working with people that aren't in public health. It's also brilliant because I'm learning so much, from others too, but it's a challenge. And sometimes I have to take a step back and explain things at a real foundational level, or explain the reasoning, behind something that I, wouldn't have to do if I was working in a team of public health professionals. They would already have that knowledge and understand why. So yeah, I think there's challenges that are across the board, no matter what sector you would work in, on just really prioritizing this health, my health issue, that I think adolescent mental health and body image is an important issue that needs to be tackled. And we want that high up on the agenda. We want that included in adolescent health programming. And so that convincing that it's something that's not just superficial, but the real impacts it's having on individual level, societal level, etc. Yeah.
Fantastic work. Let's check in with Lisa. Lisa, do we have additional questions?
Sure. Stacie, where and how can we find more information about your work and projects, especially gaming?
Cool. I get to promote. This is exciting. Well, we have dove.com/self-esteem. And then from there, there's a hub. All the tools are like free of cost. So we have a hub for schools. We have a hub for parents, tools for youth leaders. So all that's there, free, downloadable. The gaming, I'm absolutely, actually, we keep product quite separated typically in the, I can send you a link to the game as one way, but we just launched a new range of kids like body wash and stuff, the US Dove team did. And so if you go to Target, there's a QR code, and then on the back of the pack, you can play the game that way. That's one way to access it. But I can also just send a link so you could see the game and play it too. But like I said, it's usually popping up in media that if someone's playing a game already, and then we buy media as that ad placement, like for a certain amount of months in a certain market. So like it was running in Uruguay right now, and I think Netherlands last year, and it's rolling out to some other Philippines and some other markets this year. But I can also just send you the link, so you don't have to buy kids' body wash.
Thank you, Stacie. And once you provide us the link, we'll make sure that we get that to our webinar participants.
Okay, great.
Lisa, go ahead.
Yeah, so internships. Does Unilever host internships? Are dubbed specifically? It's, specific for public health students too.
Yeah, I mean, they haven't been tailored for public health students. I can't say my job is tailored for public health career people. I've had to kind of, and even my other public health colleagues and former boss, we've had to make our own path within the business. So no, there's not public health internships per se, but there is an internship program that Unilever offers. And I mean, the reason to go through like the formal internship is because there's a paid internship. But yeah, absolutely. I mean, there's opportunities. I'm happy to offer some unpaid opportunities. I just don't like, to go through the official route and get paid, you'd have to go through kind of Unilever's HR, and then they have a different internship program in each country that exists. But yeah, if someone, I mean, I'm happy, Lisa, for you to share my information with anyone who wants to look into an internship. I'm based in London, but we could perhaps look at maybe the US team would have a role as well to get some experience.
Where's the US team based?
The office is in Inglewood Cliffs, New Jersey, just over the bridge from Manhattan. Yeah, it's in New York.
I'm going to leap here, if that's okay. In our chatting before we started the webinar, you talked about next steps for you, next things you would like, and would you mind sharing that with us?
Sure. Yeah, I'm planning to pursue my PhD, something I've wanted to do for ages, but then I felt like I was too old, and then I was like, well, I'm not getting any younger, so I think I should do this. And yeah, I'm going to continue working full time, hopefully, and then work on my PhD maybe 1 day a week, go down to like 4 days a week and work on the PhD. Yeah, I'm planning to apply. I'm applying now to London School of Hygiene Tropical Medicine. The program would start in the fall, and working on a adolescent mental health with kind of a technology enhanced services intervention to create and do some research on. So yeah,
that is
excited
fantastic
to be taking this leap finally. It's like I said, it's just something I've wanted to do for years, and yeah, have my former boss is a professor at London School of Hygiene Tropical Medicine now too. So yeah, just excited about that.
That's great. Well, as someone who also went back to complete a doctorate in public health much later in life than you, I would say.
Did you?
It is possible. It is possible to keep a full-time job and do that. So we wish you all the best, and hope that you'll keep us posted on how that goes.
I will, absolutely. And yeah, if students, Lisa, if they're bringing students over to London, come visit anytime.
Great, thank you.
We hope to make that trip to England as part of Dr. McCormick's travel course a reality in the very near future. So we've got less than a minute here, and I want to sincerely thank you and give you the opportunity to say any last closing words in the less than a minute that we have.
No, thank you for inviting me. And yeah, I mean, I'm always proud to talk about my experiences at UAB, and like I said, keeping in contact and networking with the students my classmates has been incredible. So it's a great experience, and happy for others to reach out to me and ask questions, give advice. I'm happy to talk to
Great.
anyone. So thanks for having me.
All right. Thank you so much.
All right.
All right.
Bye, guys. Thanks.
Bye-bye.